More MERS cases are confirmed in Korea today. 8 were reported overnight, and the death toll reaches 7.
And for more, let's connect to Connie Kim at the News Center. Connie, give us the latest.
Well, guys, the official tally of infected patients now stands at 95. But an official from the Samsung Medical Center, where some MERS patients are being treated, say a pregnant woman in her 40s has tested positive for the disease. And it's reported she had contracted the virus at their emergency room, where a MERS patient was also at. Now, if confirmed, it would be the first case of a pregnant woman catching the virus. And although the health ministry has said that this will be the week that the MERS outbreak peaks, newly confirmed cases show that the virus is still spreading nationwide. Now, today, 2 of the new MERS infections were confirmed in Gangwon province, while another was said to be in Chungcheongbuk province. And taking a look at this chart here, up until yesterday, MERS cases were detected in 4 regions in Korea, including Seoul and Gyeonggi-do province, where the most infections have been confirmed.
Well, Connie, the government has been soaking in a lot of criticism from the public. Have they announced any new measures today in terms of fighting the disease?
Well, right, Daniel. In a press briefing this morning, Acting Prime Minister Chungcheongbuk promised for all-out efforts to contain the virus. And starting tomorrow, the MERS Central Response Headquarters and the MERS Task Force team will run virus testing on all hospitalized pneumonia patients in the 4 regions where the virus has been tracked. And if they test positive, any newly confirmed patients will be strictly isolated in a 1-person quarantine facility to prevent secondary and tertiary infections. And also, the government said it will shoulder all medical expenses for MERS patients and costs associated with virus testing. And it's also planning to allocate more funds to create special containment wards capable of blocking further spread of the outbreak.
But Connie, how are health experts assessing the government's response measures? We hear they propose some ideas in countering the outbreak.
Well, health experts and lawmakers at the Parliamentary Health Committee met this afternoon. There, they emphasized that more adequate medical supplies need to be provided to smaller hospitals, as well as MERS test kits to hospitals and state-designated quarantine centers. Take a listen to what they had to say in addition to the measures laid out by the government.
If the government wants hospitals to actively be part of treating this disease, it needs to promise it will support hospitals that are financially hit by any fallout.
Right now, it takes at least 3 hours for the current diagnostic equipment to confirm the virus after testing is done. But hospitals should come out with test results as quickly as possible so it can resolve patients' fears.
And although there is no case of MERS contractions outside the hospital, the country is still battling fears of MERS infections. Right now, around 2,200 schools and preschools, accounting for more than 10% of schools nationwide, have closed temporarily to prevent an outbreak among students. The joint South Korea WHO team is assessing the current MERS situation and will come up with additional measures to contain the virus.
Schools closed, businesses affected, and of course, the hardest hit is probably, arguably, the travel industry in Korea, right? Can you tell us about the extent of the damage so far?
Well, first of all, guys, Hong Kong has issued the 2nd highest travel alert for Korea, advising its citizens to refrain from traveling to the country. And Russia has also recommended its residents to not travel to Korea over MERS risks. And Taiwan's health authorities, meanwhile, have decided to economically compensate MERS patients if they voluntarily report their suspected case and are confirmed to have the virus. There is some good news, though. 10 Koreans in Hong Kong and China who are under quarantine after having contact with a Korean MERS patient have been taken off the quarantine list. Back to you.